One thing that's in our blood is called platelets, and what platelets do, if you cut yourself, platelets will go to that spot and help stop the bleeding by sticking together and forming little clots. As your blood goes through the stent, the platelets want to stick to it. But if you get an accumulation of platelets in your stent, it can cause a clot in your stent. It can occlude the stent. You can have a major heart attack from that. So what they do about that is they put you on an antiplatelet medicine. There are 3 antiplatelet medicines: Brilinta, Plavix, and Effient. What they do is they prevent the platelets in your blood from being able to stick together and form clots really well. But because they do that, that makes them blood thinners. So you may notice that you bruise easier. If you cut yourself, it may take longer for the bleeding to stop. Well, what you want to call the cardiology office for is if you notice bleeding out of any hole in your body, if you have a sudden onset of a really bad headache, or if any of your bruises become large but also get raised and hard if you push on them. If they become raised and hard, you could be bleeding and developing a clot, or what we call a hematoma. So if you notice you start having any of those side effects, you need to call the cardiologist office. Don't stop taking the medicine. They will let you know how they want you to take it moving forward. So if you're bleeding and it won't stop, you don't want to just call the cardiology office. You need to get treatment. So go to an emergency room or an urgent care for that. Your cardiologist or their office staff are the only people that can give you permission to stop or pause that antiplatelet medication. One medicine they don't want you to use while you're on an antiplatelet is ibuprofen, because ibuprofen also has a blood thinning effect to it. So common medicines with ibuprofen are things like Advil, Aleve, Motrin, anything called an NSAID, naproxen, Celebrex, meloxicam. Those all use ibuprofen. Tylenol does not. Tylenol uses acetaminophen. So any Tylenol product is safe to use with an antiplatelet. And then with one of the antiplatelet medicines called Brilinta, there is also a side effect of shortness of breath for some people. If you notice that side effect, take your Brilinta with caffeine, coffee, tea, chocolate, soda. People have noticed that lessens that side effect. Along with the antiplatelet medication you're put on, you will also be put on a low-dose aspirin once a day, which is 81 milligrams. That's equivalent of a baby aspirin. For more information about the new antiplatelet medication you've been put on, please refer to page 1 in the cardiac rehab book you've been given. So a heart-healthy diet is low fat, low salt, low cholesterol. Bake, broil, grill your food. Try to stay away from fried foods. They also recommend no more than 2 servings of dairy products in a day, and that you use low-fat dairy products. So if you take your plate and you cut it in half of your plate should be vegetables. If you cut the other half into 2 quarters, 1 quarter should be meats or protein, the other should be grains, breads, rices, and a piece of fruit on the side. They want you to eat lean meat, fish, turkey, chicken. Beef is okay if it's lean, like 80% or leaner. The portion size of your meat or protein should not be bigger than the palm of your hand or thicker than a deck of cards. And the last thing is salt. And the reason salt can be hard on our hearts is because salt attracts fluid. Our hearts do help our body get rid of the fluid that we drink in. So something we can all do to help prevent fluid from accumulating inside of us is only use salt in moderation. If you cook with it, don't add it at the table, or vice versa. For more information about heart-healthy diets, please refer to pages 3 through 8 in the cardiac rehab book you've been provided. I sent a referral to an exercise program called Outpatient Cardiac Rehab, or Phase 2. They put a heart monitor on you while you exercise. So there's somebody there watching your heart rate, your heart rhythm, your blood pressure. They can tell if you need to slow down, if you need to stop, take a break, or even speed up. And they do education in these classes on heart-healthy living. The referral will be on your discharge papers with the address and phone number. So on the days that you do not go to cardiac rehab, to exercise your heart, you need to do an activity that will get your heart rate up, such as walking, jogging, riding a bike, swimming, dancing, things like that. The goal is to do that activity for 30 minutes at a time. In the book, there is a page with an exertion scale on it. It's a scale from 1 to 10. If 10 is working out as hard as you can, they do not want you to start exercising at that level. They want you to start in the 3 to 4 range where you're just a little bit tired with what you do. If you can walk for 5 minutes without chest pain, shortness of breath, dizziness, once a day when that's easy, then increase it to 10 minutes till you get to the 30 minutes. There are also pictures of exercises in the book that you can do to warm up your muscles before you walk or whatever you choose to do. They're mostly stretching type of exercises. There is a page in the book that shows symptoms if you have while you're exercising that you need to stop exercising. If you're having the symptoms in the middle of the page, if those don't get better in 15-20 minutes after you stop exercising, call your cardiologist office. If you're having the symptoms at the bottom of the page, if those don't immediately start easing up and fading away when you stop exercising, you need to call 911 for those. Now, if you do have nitroglycerin tablets, you have a prescription for nitroglycerin, if it's chest pain, you can use those first. And if 3 of them don't relieve your pain, then call 911. For more information on the type of exercises that you need to do for your heart, please refer to pages 11 through 23 in the cardiac rehab book you've been provided. If you did go for a cardiac catheterization procedure, they do the procedures either through the wrist or the groin. Sometimes they do both. The dressing that you have on needs to stay there for 2 days. In 2 days, you can just kind of peel them off like a Band-Aid, and then you can start cleaning those sites with soap and water, and then you don't have to cover them again. If you want to, you can put a Band-Aid there, but if you do that, take it off every day to shower and put a fresh one on. If they went in your wrist, for 3 to 5 days, they do not want you to submerge that hand into standing water. Also, no powder, lotion, or ointment to that wrist for 3 to 5 days. For 3 to 5 days, they do not want you to lift over 10 pounds with that hand, and that's to prevent bleeding. And one thing we do, we don't even realize we do it, but when we move around, like we go from sitting to standing, we tend to push up with our hands. That is more than 10 pounds on that wrist. You also want to be careful twisting that wrist a lot, so opening bottles, bending it, opening cans. All of that is to prevent bleeding. If you start bleeding, you want to get tight pressure on it. Keep holding that pressure for at least 10 minutes before you check it. If it's still bleeding, put it back on for another 10 minutes. And keep doing that till the bleeding stops. If it swells and gets firm and hard, it's bleeding under the skin, you do the same thing. And you want to keep holding pressure on it till it softens. Or if you really want to, you can put pressure on it, call 911, and just hold it till they get there and take over for you. If they went in the groin, in 2 days you can take the dressing off. You can start cleaning the site with soap and rinse it off in the shower. But for 5 days to a week, they do not want you to submerge into water. For 5 days to a week, no powder, lotion, or ointment to that groin. And both of those things are to prevent infection. Also, they do not want you lifting over 10 pounds and do not do more bending, stooping, or squatting than you have to. Do not ride a bike. Do not climb a ladder or a bunch of stairs, and don't bend over and pick anything up for about a week. And that's to prevent bleeding from that site. If you got a stent or you got a balloon procedure, that opened up the blockage, but it does not prevent further plaque from building up. So things you can do to help prevent plaque from building up. Don't smoke or use nicotine. If you drink alcohol, only drink in moderation. So for a woman, that's no more than 1 drink of alcohol a day. For a man, it's 2. Take all of your medications as prescribed. Go to all of your follow-up appointments. That way, if anything's going on, hopefully it'll be caught sooner rather than later. If you have a way, monitor your blood pressure every day. Write it down. Take it to your doctor. But if it starts being consistently high, like 150/90 or higher, let your doctor know about that. I recommend checking it at different times of the day. Some days do it in the morning, some days the afternoon, some days the evening. That gives you a better idea of what your blood pressure is doing all day long. Also pay attention to your stress levels, because a lot of stress can physically affect our heart. Try to make yourself take some breaks throughout the day and find something you enjoy doing that helps you relax. There's really 6 things we can focus on for our heart. Keep your cholesterol levels as normal as possible. Keep your blood pressures as normal as possible. If you are a diabetic, keep your blood sugars as normal as possible. Take all of your medications as prescribed. Try to get your heart rate up every day to exercise it for a goal of 30 minutes or at least 3 times a week. And then eat as clean as you can. My name and number are on the back of the book. If you have questions, please feel free to call. Thank you for trusting Shannon with your care.